Hypoxia is a condition in which the body, generalized, or parts of the body, local, is deprived of adequate oxygen supply. It is said that the body can be in a hypoxic condition after strenuous exercise, but this is quickly resolved with rest without treatment. The body compensates for this by increasing depth and rate of breathing. Generalized hypoxia also occurs at high altitude because oxygen concentrations fall, and this can lead to altitude sickness. If this happens, you may need to give them supplementary oxygen and move them to a lower altitude. Hypoxia also occurs in healthy individuals when breathing mixtures of gases with low oxygen content. This can happen when diving underwater, especially when using closed-circuit rebreather systems that control the amount of oxygen supplied in the air. Even with standard scuba diving, hypoxia can occur as the depth increases and the partial pressure of the oxygen gets higher. It also happens when there's been a contamination of the air supply when air tanks are filled, causing a drop in available oxygen. This, added to the effect of the contamination, can cause serious problems or death. People can become hypoxic in many conditions including heart attacks, shock, asthma, poisoning, drowning and cardiac arrest. Hypoxia can result from self-harming like drug overdose and strangulation. A mild and non-damaging intermittent hypoxia is sometimes used intentionally during altitude training. This helps to develop an athletic performance adaptation on both the systemic and cellular level. The symptoms of generalized hypoxia depend on its severity and acceleration of onset. In the case of altitude sickness, where hypoxia develops gradually, the symptoms of lightheadedness, tiredness, numbness, tingling in extremities, and nausea, which then progress on as the body becomes more hypoxic. In more severe hypoxia or hypoxia with very rapid onset, confusion, disorientation, hallucinations, behavioral changes, severe headaches, reduced level of consciousness, breathlessness, pallor of skin, cyanosis, tachycardia, and possibly even death. Local hypoxia is where the problem is in one part of the body. The tissues are not being perfused properly with oxygen, and it may feel cold and appear pale. When local hypoxia is severe, it can result in cyanosis, a blue discoloration of the skin. If hypoxia is very severe and ongoing, a tissue may even get gangrene. Pain or numbness may also be felt at or around the site. Hypoxia in first aid can be treated with the use of medical oxygen. Blood oxygen saturations can be found using a pulse oximeter, and you can also look for the signs and symptoms of the patient if one's not available.